Hello, everyone, and welcome. We're just going to give a few moments for folks to get into the room, and then we'll get started today. All right. Hi, everyone. Thanks for joining us on this Friday during West Coast lunch hour, at the very least. So I hope you have some lunch if you need to eat and enjoy the conversation at the same time. We will go ahead and get started so we can make the most of our time here together today. My name is Kara Q. Smith. I use she, her pronouns, and I am zooming in from the unceded lands of the Nisenan people. I'm the manager of programs and organizational advancement with Californians for the Arts, and we are very glad to have you here today. I hope that you will please introduce yourself in the chat and share where you are coming from while I continue to share an introduction. So on behalf of everyone at Californians for the Arts, welcome to the fifth and final program in the Arts Work webinar series, where we take a deeper dive into how artists, arts workers, and culture bearers work to create vital social impacts and explore what the creative workforce needs to succeed and thrive in California. Next slide, please. Thank you. Each week in April has brought a panel of thought leaders and practitioners together around one of the themes of Arts, Culture, and Creativity Month to share their change-making work and to discuss new strategic possibilities and the policy changes that we should be thinking about. Today's discussion will focus on how the arts work to heal. Before we get started, today is the last day almost of Arts, Culture, and Creativity Month. And I'd like to hand it over to my colleague, Eduardo Robles, to talk a little bit about how you can engage and take action.
Hi, thank you so much, Kara. My name is Eduardo Robles. I use he, him, his, and I'm calling in from unceded lands of Chumash and Tongva in the city of Los Angeles. And I am the manager of communications and field engagement. And I'll be going over some ways that you can engage beyond ACCM. So sad to see Arts, Culture, and Creativity Month come to an end, but we can still engage. You can visit our website at our video library and view, revisit all of the panels that we hosted for the arts work theme. So you can see past webinars on how the arts work to empower, engage youth, build community prosperity and resilience, advance social justice and racial equity. That brings together leading thought leaders and practitioners around the themes, impact themes. So do revisit these videos and take a look again and reshare and use them as you wish. And we also have this really handy social media toolkit that you can use beyond April that has social media posts ready to use, graphics and hashtags that really promote these impact areas of how the arts work to heal, advance social justice, build community and create jobs and empower youth. So if you want to champion the arts and its impact, you can use this social media toolkit beyond ACCM and keep on championing the arts. We also had this an arts work showcase where we invited artists to submit artworks around those impact themes for ACCM, the arts work. So visit our page, our arts work page, and we had over 500 entries. Thank you, California artists, creatives who submitted work that were examples of the impact themes. and they're already and uploaded on our website, so you can scroll and see nice grid of showcase art. And we are also, activating the state around arts and cultural policy issues. Arts Advocacy Week is this week, so we do encourage you to send in our action letter to support some of the legislation we're backing. One of them being $1 for the Arts to increase baseline funding for the California Arts Council, and $50 million to fund the California Creative Workforce Act, which was passed last October, and would really help diversify the creative workforce by providing living wage jobs that are specifically aimed at pathways for BIPOC people. Also, you want to sign up for our action alerts. It being the budget cycle. Right now, we're paying attention a lot to what's going to be approved in the budget cycle. So you can sign up to our action alerts to see what campaigns and actions we're taking, and you can help us out in championing these issues or actions. Visit our Take Action webpage, and those have all of the different legislations we're backing in actions, and it's just easy to use. Just press a button, fill out a letter, share social media, etc. And all of these actions, we really want to amplify all of the capacity building for the arts and culture in California and for our field. So we do encourage you to join the movement, to join us, and keep on activating the state beyond arts, culture, and creativity. So with that, I'm going to hand it over back to Kara.
Thank you, Eduardo. So before I hand it over to today's moderator and our fantastic panelists, just a little bit of housekeeping. Throughout the program, feel free to use the chat to share resources or to share reactions and comments to what you're hearing. There will be a Q&A at the end of the panel. Feel free to enter questions into the Q&A box at any point during the conversation or place them in the chat. Today's conversation is being recorded and will be sent to everyone who registered, along with links and resources, like a lot of the ones Eduardo already mentioned, from today's conversation. With that, I'd like to turn it over to Trevor Davis, Executive Director of Reach for Community. Trevor.
Thank you, Kara. Thanks so much to everyone at Californians for the Arts. You are an amazing team, and you deserve all the praise you can get for pulling us together and for keeping advocates energized and organized to make the arts thrive in California. So thank you very much. And thank you. I'm so honored and proud to be a part of this wonderful conversation. We have incredible panelists as a part of this. And I want to introduce them, and I want to thank them for being a part of it. But I also want to first thank all the advocates that are on this call as well. You are the reason that we do all this, because you are the ones that drive the arts forward in California. So thank you for being a part of it. As Karen mentioned, I run a nonprofit. It's a relatively new nonprofit called Reach for Community. And it is all about using the arts for social impact. Specifically, our mission is to articulate and advocate for the field of arts-based social work. So by articulate, we mean we are looking for the field of all the ways that the arts serve our communities and serve our civic needs. And we want the field to self-identify, to see ourselves as arts-based social workers, and to have, with that collective broader umbrella of the work we do to serve our civic needs, to then advocate for workforce development funds and institutional adoption and so forth, because we're more powerful together. And so that is the frame of arts-based social work that we're trying to push. And REACH is an acronym. It stands for, just as in the way that STEM or STEAM promoted a whole new set of priorities for education in the 21st century, REACH is an acronym that stands for the power of the arts to revitalize, educate, activate, connect, and heal our communities. That is economic revitalization, education, arts integration, activate civic engagement, connect to have cross-cultural understanding, to bridge communities, and finally to heal, of course, which is why we're here. And so with that, I will introduce our incredible panelists, starting with Dr. Jill Sankey, who is the research director in the Center for Arts and Medicine in the University of Florida. She is the Director of National Research and Impact in the One Nation, One Project initiative and co-director of the EPI Arts Lab, a National Endowment for the Arts Research Lab at University of Florida. She served as senior advisor to the CDC during COVID pandemic, and she is an affiliated faculty member at the UF School of Theater and Dance. She also is an artist herself, has been a principal dancer and soloist with Lori Belly-Love and the Isadora Duncan Dance Company in New York, and I guess performer and choreographer with Dance Alive. And so she is an incredible researcher as well. She's a leader with the national stage and great respect all around, leading people to really engage in the power of arts in medicine. So there's a lot more to talk about with Dr. Sankey, but thank you so much for being here, Jill, and excited for you to be a part of this. Next up is Dr. Tasha Golden, who works closely with Dr. Sankey. And hi, Tasha. She is the Director of Research at the International Arts and Mind Lab at Johns Hopkins University. She is a national leader and a consultant in arts and public health. She holds a PhD in public health sciences, and she serves on several national health initiatives, is an adjunct faculty for the University of Florida's Center of Arts and Medicine. And she's currently leading a pilot evaluation of Culture RX in Massachusetts, the first arts-on prescription model in the US. Which we'll talk more about. It's very exciting what that is, what's happening there. She's also a career artist and entrepreneur. We are surrounded by artists today. She has an incredible band, which y'all should check out, called Ellery, which has toured the US and abroad and featured in a lot of the shows you've probably seen on ABC, Showtime, Fox, Netflix. So she comes as a deep research professional, as well as an artist herself. So again, much more to talk about with Tasha, but thank you so much for being a part of it. And last but not least is Ping Ho. Hi, Ping. She is the founder and director of UCLA Arts and Healing, which offers trauma-informed and culturally responsive training and public education and the use of arts integrated with mental health practices for self-discovery, connection, and empowerment. The work represents the nexus of her graduate education in counseling psychology and public health with a lifelong experience in performing arts and developing integrative health programs at UCLA and Stanford. Ping co-developed and served as principal investigator for the evidence-based training program Beat the Odds, social and emotional skill building delivered in a framework of drumming. She spearheaded the development of the certificate program in social emotional arts and a sustainable social emotional arts on a shoestring. That's very alliterative training program to support arts, movement, music, and writing for individuals and groups in any setting. She's a steering committee member for the UCLA Integrative Medicine Collaborative and serves as associate editor for the Creative Arts Therapy section of the Journal of Alternative and Complementary Medicine. Among many other things, she's an author of award-winning books and just a wonderful collaborator who I've known for a bit now and has encouraged me along the way. So Thank you for being a part of this, Ping. Okay, so you know what, I'll jump right into this by, first of all, kind of looking at a field overview. You know, for those, there are going to be those on this call who are very familiar with arts and medicine, of course, but I'd like to just kind of ground our conversation in the human impacts of your work and all the work that people who are in this field are doing. Just open to the panel here. What are, oh, you know what, I'm sorry. I am moderating, jumping right in. I'm so excited to get into the conversation. I want to turn it over so that these wonderful panelists actually get to talk about their work first before we dive in. So with that said, let me turn over the mic to Dr. Sankey, to Jill. Thanks.
Thank you, Trevor. I'm really excited to be with you all this afternoon. I know others in the field have been watching the state of California and a lot of really exciting things that are happening in your state. So it's really a delight to be in conversation with you all this afternoon. I am going to sort of offer a sprinkling of, in keeping with the beautiful spring weather that we're having in New York today, wildflower seeds that will hopefully seed our conversation. So in doing so, I'm going to just start by kind of sharing how I locate myself at the intersection of the arts and health, both healthcare and public health. And I want to start by saying that I locate myself physically in New York City, which is land of the Lenape people. And I'm really delighted to be joining you this afternoon via Zoom. So thank you again, Trevor and Kara, for the invitation to be in conversation today. As Trevor mentioned, I first and foremost locate myself in this space as an artist. I'm a dancer. I also am a very amateur musician, but I am claiming the title of musician because I play music every day. And that's it's become increasingly, particularly during the pandemic, an important part of my own well-being. In fact, to the point that the discoveries I've made as a new musician over the past couple of years have made me feel like I've understated the relationship between the arts and health for the past 27 years that I've been in this field. So I experience that deep connection between the arts and health and well-being every day myself. I started working in this field in 1994 as an artist in residence in a hospital-based program, the UF Health Shands Arts and Medicine program, which is located in Gainesville, Florida. And for many years, I worked as a dancer in residence, dancing, performing in the hospital, dancing with patients, many long-term patients, and really just exploring, along with a few other fledgling programs at that time, how the arts belonged in hospitals. And now it's really, really exciting to see that about half of hospitals in the United States have arts programs and are investing in the arts. So that has been a major paradigm shift over the past 30 years in the realm of healthcare. For us at the University of Florida, that clinical program, which we consider the other half of our whole, in partnership with the Center for Arts and Medicine, which is our academic program, I was also teaching on the dance faculty at the University of Florida while working as an artist in residence, and students were just so curious about what was happening in the hospital. And so within months of my work, beginning in the hospital, I had half a dozen students doing independent studies, and it became clear that we needed coursework because there was energy, there was interest. I think the emergence of arts and health provided artists with yet another way to make meaning in their artwork and to bring their artwork out of studios and off stages into really deep connections with people. So our students were very interested. So in 1996, we created a course called Dance in Medicine, and then a Dance in Medicine undergraduate certificate. Now in the Center for Arts and Medicine, we have 4 undergrad certificates, and we now have an online MA, Master of Arts in Arts and Medicine, and 2 graduate certificates, one in Arts and Medicine and one in Arts and Public Health. And Tasha is one of our amazing faculty in that program. And we have about 70 graduate students right now. So we have really seen throughout our history in the Center for Arts and Medicine, a field develop, and not only a field, but an academic discipline. We have dedicated field journals. There's a beautiful evidence base that is developing through the work of my fellow panelists and others in the field. So I also locate myself as an educator in the field. I've helped develop those programs and teach, don't teach currently in those programs as much, but teach still some in those programs. And I also, as Trevor mentioned, I'm a researcher. I'm a mixed methods researcher. So my research jam is big, messy, mixed method studies. I love embracing all sorts of forms of data, ways of knowing, mixing them together in a big pot and making meta inferences and making meaning of a lot of different kinds of data, including artworks and narratives. So I am a very active researcher in the field, and I run 2 labs at the University of Florida. One is our very dynamic interdisciplinary research lab, which has 35 members, students at all levels, staff and faculty in the center, people who join us remotely from all over the globe, including our graduate students. And this is a very dynamic lab in which we run usually about 8 to 10 studies at a time. And so we've got just a phenomenal team. We finish a lot, we celebrate a lot, and we really enjoy a dynamic research environment in that lab. I also partner with Dr. Daisy Fancourt at University College London. She and I co-direct the Epi Arts Lab, which is a National Endowment for the Arts research lab at the University of Florida. And we do statistical studies. I am not a statistician. Daisy and her team are the statisticians in this work, but we work together to undertake statistical epidemiological studies of ways in which arts participation is associated with an array of health outcomes, physical and mental health outcomes at the population level in the United States. So we think about how people are accessing the arts, the disparities in arts participation, how that impacts health. We think about arts participation as a health behavior in our research. And we've published a bunch of studies. That work, like it has in the UK, is really intended to drive policy change in the United States. This lab was born out of the Creating Healthy Communities national initiative, which I had the pleasure of, again, working with Tasha on and leading on behalf of ArtPlace America. And the goal of that program is to make arts and public health a thing in the United States. It came off the heels of many years of research that I've done looking at how the arts work in public health in other parts of the world. And so that project was about making arts and public health a thing in the United States, because unlike the healthcare sector, the public health sector had not yet really taken up the arts and recognized artists and arts resources and arts organizations as available resources for health in communities. So we've been working for the past 5 years to make arts and public health a thing in the United States. And the Epi Arts Lab was a direct development that came out of that initiative. The work that Dr. Fancourt has done in the UK, she's done published almost 100 papers that cite associations between arts participation and health outcomes. And that work has helped drive the implementation of social prescribing in the United Kingdom. And now that system exists in other countries as well. And as Tasha said, it's bubbling up in the United States, and Tasha is doing research on one of the most exciting pilots that's happening in the United States. So social prescribing is a system wherein health providers prescribe arts and cultural and social activities, and the health system pays for them. So we're exploring the feasibility of social prescribing in the United States. We're rolling this fall into implementation science studies to look at that feasibility. And again, these statistical studies are aiming at policy that would create something akin to social prescribing in the United States, recognizing that we have a very different social, political, and healthcare context than the United Kingdom and other countries in which social prescribing is established. And again, there's some very exciting policy things happening in California that I think will play into this landscape as well. So all of this together is, again, sort of evidence indication that we're seeing an emerging field of arts and public health to exist alongside arts and healthcare. We're seeing artists craving education and training to be able to do more effective work, recognizing again that artists have always worked to make their communities healthier and to make the human experience better. But artists are now looking for more ways in which to partner with healthcare systems, healthcare professionals, and public health professionals and systems as well. So we're seeing programs like ours, and we have many peers now in educational institutions around the United States offering training and education opportunities. So we're seeing the creation of jobs. So we're seeing more and more people employed at the intersections of arts and health, either in hospitals or in community health kinds of contexts. And we're seeing more and more energy bubbling up around policy as well in the United States. So I'm going to pause there and pass off to my colleagues. Again, I hope that these comments will help drive some conversation with you all a little bit later in our time together. Thank you, Trevor.
Fantastic. Thank you so much for that rich overview, Jill. That's so much to dive into, and I'm so grateful for all the work you've done to really make this work more mainstream and established. I'll pass it over to Tasha to speak more about your work.
Thank you so much, Trevor and Kara, for the invitation to be here. Thank you all. And thank you, Jill, for getting us started. It's really lovely to be able to be here and talk with all of you doing so much overlapping work, to be able to just dive into some things. I thought there's so many things that we could talk about, like intersections of arts and health, that I thought, you know, maybe this is self-serving in some ways, but I would just talk about the three things I'm thinking about all the time right now, like the things that are on my mind. And then maybe that will be the most fruitful conversation for everyone anyway. So, as Trevor said earlier, I spend most of my time directing research for the International Arts and Mind Lab at Johns Hopkins, and these days involved in lots of different public health and arts initiatives. But my first career was in music. And for many years, I toured full-time as a singer-songwriter and had songs in that role about things like depression and domestic violence. And all over the world, those songs, those specific kinds of songs were the ones that people lined up after shows wanting to talk about. And so over the years, I've had hundreds of people share really difficult and personal stories with me. Many people who shared stories of like abuse, for example, and followed their story by saying that I'm the first person they had ever told. And this happened so consistently, like across cultures and across geographies, that I had to start wondering what was happening with that. Because like, if they'd never told anybody else, that means they'd never told, especially about things like a history of abuse, that means they'd never told a doctor, a therapist, not even like a spouse or partner. And it means that the community organizations that are set up to meet the needs of survivors had clearly never been able to reach these individuals, right? So what was it about a music venue or about music or about me or about a song that made these stories speakable for the first time? And whatever that is, what does it mean for healthcare and for social services? I wound up in public health, which is never where I thought that I would be, because I spent years unable to let these questions go. And they really circle around this main one, which is, what do we not know about a population or an experience? Because we tend to expect or require that people convey their experiences in limited particular ways. And how is what we don't know affecting us? And I ran into these same questions when I founded a program for girls that are in the juvenile justice system here in the States called Project Uncaged. It's a trauma-informed creative writing program. And no surprise, quickly noticed that the girls shared really different information in their poems and songs than they shared in conversations or on questionnaires. So again, if there are experiences and insights that are only emerging via the arts, then what do educators, scientists, nonprofits, policymakers, doctors, youth workers, any of us, what do we not know? Because there are, like, we're not looking to the arts as a source of communication and data about the human experience. So in my work now in arts and public health, one of the things I spend a lot of time on is, how do we embrace the fact that humans know and understand and share different things in different ways, depending on the spaces that we're in, the media we're using, the people that are involved. And as like a quick example, I actually have a two-part article coming out any day now, that it's a study of experiences and perceptions of violence among girls and young women. And I used 4 surveys that had already been administered. I just analyzed their data. And then 3 new sources of creative writing. And I said the article's in two parts. The first one's going to tell everybody, like, what did we learn from these methods about violence? The second one will tell you what I learned when I compared the survey methods to the creative writing methods. And there's a whole bunch that I could tell you about that, but the articles are coming out soon. So I will just tell you that the arts-based methods gave us twice as much information as the surveys about violence. They were more trauma responsive for a lot of reasons. They gave us urgent and actionable data that the surveys missed. Like, as one example, the largest writing group, the priority concern for them was domestic violence and intimate partner violence. The parallel survey that had been administered across the public school district didn't ask about those forms of violence at all. So we know from comparing those two methods that if decisions are made based on that survey, they're going to miss the priority concern of 50% of the student population, right? We also found that we got to really improve dissemination because we published books of the poems that were submitted. The writers were invited to local radio programs. There were like standing room only public readings for the work. There's a lot of community engagement and public engagement, which doesn't tend to happen with surveys. So that's the first thing. The second effort that I've been working on recently is how arts and culture help us address the full definition of health. In 1946, the WHO defined health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. But most health research and policy and practice is still aimed pretty narrowly at that absence of disease, which usually means that we're focusing on healthcare, on medication, on individual level solutions, basically trying to get rid of things that we think cause harm or pain, but usually just at that individual level as well. And all of that is so important. Like, I want to make sure I'm not heard as implying anything else. Like, that's been my mantra all through the pandemic. Like, we need the absence of disease and harm, and we need that absence to be equitable. And we've known for decades that absence isn't good enough. Like, we also need well-being. We have to make well-being increasingly and equitably possible. And that requires arts and culture. And why does that require arts and culture? Well, typically, when asked what is well-being, the answers that people tend to give, and please drop your own answers in the chat. It'd be lovely to hear what you all think well-being is or how you define it. But the answers people tend to give include things like meaning, connection, purpose, curiosity, belonging, hope, relational support. And these experiences fall under a really general umbrella of what we might describe as arts and culture. So my earlier discussion was like, without arts and culture, we cannot know ourselves and one another well enough. And here I'm saying that without arts and culture, we can't provide well-being. We can't meet that charge of supporting a full version of health. And I'll also point out that some of the well-being definitions that people give point to the presence of suffering, actually, like support or hope only really makes sense in a world where things aren't perfect, where people are hurting. So, and art is actually good itself for revealing this too. Like, it isn't always beautiful or kind or soothing. It's often provocative or tragic and challenging. So sometimes our engagement with art is less about alleviating a difficult experience than accompanying it or articulating it. And art obviously doesn't exist just to make us feel good, but humans have long looked to art to help us be well. And that distinction really matters. In an absence-centric model, we can't get at it. Like, we have to think about what's here. What do we have that supports us even when we're suffering? Or like, what does it look like to thrive or have well-being in the context of a human life that is inevitably going to include suffering? Those are some of the questions that I get excited about. So would love to send all of y'all out here imagining some answers with me. And then the third thing that I'll touch on has to do with the social prescribing effort that Trevor and Jill mentioned, but just kind of how do we create models of care that put the benefits of the arts into practice at a structural or systems level? And the Culture RX program that they mentioned is the first pilot of that. So I'm happy to share more later if you'd like, but just really quickly, it's right now 12 cultural organizations, like museums, art classes, zoos, nature trails, all kinds of things, working with multiple healthcare providers, pediatricians, mental health counselors, social workers, et cetera, to be able to support health, provide for positive childhood experiences, foster connection, cultivate well-being and belonging. So we're going to share findings, like specific findings about that in a few months, and I can talk specifics about that particular program later if you all want. But beyond that particular pilot, I'll touch on just a couple of general things that have been on my mind as far as this goes. Like, the first one is just making sure that we're taking care of artists and culture workers. Like, often in arts and health conversations, there can be an assumption that artists are all doing great. Like they're out there ready and waiting to provide cultural, like creative forms of healing and care work. And many of them are, absolutely. But studies also indicate that many artists themselves lack access to adequate care. Many themselves are having mental and social health concerns. Many are living with financial stress that itself strains their health. And full disclosure, the damage that a music career caused to my health is why I'm no longer a full-time musician. So we have to ask, how are we taking care of the people who do the work that benefits us? And this includes providing healthcare and financial care. And I believe it also includes providing training and support in their work as co-creators of health and well-being. And Jill hinted at this earlier, Ping's work goes at this too, but I can't tell you how many art organizations have contacted me over the last couple of years asking for trainings in trauma-informed practice because their artists are seeing so much pain in their communities and they're looking for how best to respond. And speaking as an artist, like we don't automatically know what to say to somebody who's suffering or how to help them simply by virtue of being an artist. Like that's not a thing. I don't know what resources are in your community just because I'm an artist who showed up to work with you. So if we're aiming to better integrate the arts into health and social care, we have to make sure that artists are supported, right? And another way that I think about this also is that we need to ensure that artists and arts organizations can also refer their participants to services. Artists are often put in the position of first responder, like the first recipient of a disclosure. So probably any artist on this call has spent days at some point making calls, like trying to find a resource or a support for a person we met in an arts context who shared their problem with us. And when that happens, we're often on our own, like with just our wits or our empathy or our personal connections, and we can't create community health and well-being like that. So we don't want a situation in which healthcare or social providers can refer people out to an arts organization, but that arts organization has no means of referring their participants to any needed community resources, including healthcare, housing assistance, whatever it might be. Like this is not going to be sustainable, right? So the concept of social prescribing can be great, but to be honest, the term itself isn't great for where we want to be. Like prescribing always is going to imply a person with power who can write a prescription. So it can reify that biomedical paradigm that links us to power models where a provider is the hub of community care. And that means they can become the gatekeeper of it or the bottleneck of it, right? But in community health, a lot of organizations in the US, when we have models of community care, all the organizations are able to link to one another and refer to one another, which is the ideal situation. In the US, we don't have social prescription, but we do have these models of care that have increasingly included things like faith-based organizations, even barbershops as trusted cultural spaces and communities. So I see a lot of promise in integrating and elevating arts and culture into these existing networks and then providing more education and best practices to support that genuine integration. So those are three things that I'm excited about. Art is a way of knowing and communication, how arts and culture help us provide for that other half of what health is, which is well-being, and then how we instantiate these in communities. So with that, I will pass it back to Trevor. Thank you all.
Hi, everyone. Just having a bit of internet issues, but while I am working that out, I will pass the mic here to Ping. Thank you so much, Tasha, and Ping, please take the stage.
Thank you. I got into this field because I have engaged in a lifetime of participation in the arts for my own mind, body, spirit health. And I would like to begin by acknowledging the Tongva people on whose land I'm speaking to you from today. So at UCLA Arts and Healing, we live on in the land of prevention, I call it, between the world of the arts and the world of therapy, where we teach people how to provide socially and emotionally supportive experiences without crossing over that boundary of therapy, which we define as identifying and treating disorders. And we call this field social emotional arts. So I'd like to, I'm going to actually do a brief PowerPoint. Right. I'm going to give you 5 main talking points that I find most effective in advocating for the social emotional benefits of the arts. So first of all, the arts provide nonverbal pathways for communication when words are not accessible due to trauma, stress, language ability, or culture. Active participation in the arts engages multiple regions of the brain, which calms lower brain stress responses and restores upper brain executive functions necessary for learning. Moreover, the arts are uniquely capable of enhancing a broad range of positive emotions and not just reducing negative ones. We build agency and resilience in the discovery of something we can do to feel better. In addition, the arts are uniquely powerful at building social connection. Shared creative experiences offer an organic way to be truly seen, heard, and connected. Consequently, the arts have the unique ability to address public health problems with disconnection at their core, such as trauma, loneliness, intolerance, chronic pain, end of care, and now social isolation.
Ping, I'm so sorry to interrupt you. I just wanted to let you know that it doesn't seem we can see your slides.
Oh, that is so weird. Okay. Thank you for letting me know that. Oh, it's because I forgot to share my slides.
Oh, gosh. No worries. What you said was wonderful, but I just wanted you to know.
It is totally fine. And let me end my, sorry, it's this tech thing. I'm going to end the slideshow so that I can actually see to share my slides. I definitely want you to be able to see them. Okay. So now I have to move this panel over. Okay. All right. So now let me see. What can you see? Oh, I must have enabled. Sorry, let me try again. Okay, can you see?
There we go.
Okay, great. All right. So I will just advance my slides to the place where I should be right now. Okay. All right. Okay. So these are the actual, when I was talking earlier, the executive functions in the brain that can come back online when we calm the stress responses from the lower brain. Okay. And so I was at in addition, the arts are uniquely powerful at building social connection, and that shared creative experiences offer an organic way to be truly seen, heard, and connected. So, and I was mentioning that the arts then have the unique ability to address public health problems with disconnection at their core. So, and finally, my fifth point is that the arts offer a powerful medium for acknowledging, embracing, and transcending culture. So our approach is to integrate mental health practices to maximize the innate benefits of the arts, as well as to minimize any unintended consequences of participation, such as self-judgment, performance anxiety, and excessive vulnerability. So here are some examples of how we do this. We emphasize process over product, and we remind participants that there's no wrong way to express themselves creatively. And our careful use of non-judgmental language facilitates engagement and dialogue. So for example, we avoid negative as well as positive judgment, because comments like, I like it, it's beautiful, or good job, if not perceived as disingenuous, can create performance anxiety or seeking of external validation. And what do people typically say when they hear good job or I like it? Thank you, right? It's a missed opportunity for dialogue. And instead, we point out specific details of what we see and ask them to tell us more, or we point out strengths that we wish to encourage. So by being specific about what we see or notice, people feel truly seen and heard. So in addition to non-judgmental practices, we use synchrony to affirm one another. Synchrony can be mirroring, as in singing the same notes or doing the same movements. It can also be responding to one another's ideas, as in call and response in the drumming world or yes and in the theater world. Synchrony is a metaphor for empathy because it says, I see you and I hear you. So research on synchrony in rhythm and movement shows that it evokes connection, compassion, and altruistic behavior. And it's also rewarding to the brain. So being in sync activates the same part of the brain that responds to a monetary reward, which means we're actually hardwired to want to be in sync with each other. And in addition to non-judgmental language and synchrony, we use reflection and sharing to help participants feel seen, heard, and connected. So research has shown that the addition of reflection and self-disclosure in art forms as diverse as drumming and writing results in greater biological and psychological indicators of stress reduction. And reflecting on what we notice or discover in the process of creative expression makes social emotional learning more explicit and ensures that intended lessons are learned. And self-disclosure builds empathy and connection among participants. People in our community programs will often shed tears when reading aloud something they've written. They may report a trauma that has never been shared before, only to discover that others in the room have had the same experience or very similar. And in the space of an hour, a room full of strangers can become each other's closest confidants. This is accessible, low-hanging fruit at its best. So finally, we take proactive steps to create a supportive space and to empower facilitators with creative tools for managing stress responses in themselves and in others. So I'd actually like to share a story about a woman who came to one of our trauma programs. She was very disheveled, very thin, sitting with her arms crossed, her head down, her legs crossed in a corner, and didn't budge the entire time. Her head was down, if I didn't say that. At the end of the session, she told the instructor that she didn't think she heard anything, and the instructor said, well, you probably heard more than you think you did. See what you remember in the morning. So the next day, the woman called me, and she said, I did remember some of the Tai Chi-like moves that we did to push things away from us that we don't want and to bring things to us that we do want. I remembered to do my yoga poses this morning for grounding, and I had the presence of mind for the first time in my entire life to hang up on my abusive husband. The following week, she came back and she tried to tell her story to the group. And now, in retrospect, I realized that all that body language was classic signs of trauma. And the next week, she tried to tell her story and no words were coming out. This is another classic sign of trauma. No sound was coming out and tears were streaming down her face. So the instructor got down to her eye level, held her hands, said, breathe. Now make a sound. And then she invited the woman to walk around the room with her to feel the ground under their feet. And when the woman sat down, she invited the woman to lead her in some arm movements that the instructor would follow. And again, the empathy, the connection, the being present. So just after that, the woman was able to speak, and she told her story of how her culture had forced her to marry her rapist. She had a lifetime of rage against this man and children by him. And when the session was over, about half a week later, she called me and said, uh-oh, I'm feeling feelings, what do I do? So previously she had dissociated and just sort of left the room to not feel these feelings. Now she was feeling them because she was actually able to tell her story. So I asked her what makes her feel good, and she said, listening to music. So I said, then listen to music and see how that helps. I don't recall her coming to the next 2 sessions. I do recall her coming back 2 months later to a movement program, and you wouldn't have known it was the same woman. She was glowing, she was smiling, her hair was done nicely, she was touching people. And so afterwards I asked a clinical psychologist, how long does it usually take to get someone from here to there? And she said about a year to build that trust relationship, not to mention all the cost. So I don't mean to imply that this work is magic. However, this is public health at its best because most people have access to some form of music. And this is how social emotional arts practices can enable us to sustainably support equity and inclusion in mental health. So here are some examples of our signature programs that are being implemented in schools and other settings nationally. Beat the Odds integrates the power of group drumming and group counseling in an 8-session weekly program of 45 minutes each. It's designed to build the core strengths shown here. Our UCLA research has shown that this program can reduce a spectrum of behavior problems in children. And its scripted curriculum enables sustainable delivery and does not require musical experience of the facilitator or the participants, and it can be adapted to any age group. Our Social Emotional Arts on a Shoestring program offers a menu of supportive art, movement, music, and writing activities that are scripted for ease and integrity of delivery to groups or individuals of any ability, and the activities are designed to accommodate settings with few resources. This program was designed to achieve the goals listed here, the outcomes of which we have been documenting at UCLA Medical Center. Our certificate program in social emotional arts offers practical tools for addressing challenges at the front lines of need, such as trauma and culturally informed communication, group cohesion, neurodiversity and learning differences, needs assessment and evaluation, self-care tools for managing stress, and best practices in 6 different art forms. The intention of this training is to enable people to design, deliver, and evaluate their own social emotional arts programs. Our free monthly Hope series was initiated at the start of the pandemic to support the resilience of our global community. These workshops, recorded for later viewing, offer experiential learning on topics such as grief, social justice, anxiety, resilience, connection, and stress management. We also offer workshops related to our book, The Innovative Parent, which makes these practices accessible to parents and professionals as a public health resource. So almost everyone travels through education, healthcare, and recreation. Imagine a world where everyone can find social emotional support in these settings. I can personally testify to the transformative value of social emotional arts, even in cyberspace. Collaborating with and supporting arts and other professionals in this vision can make it a reality. We invite you to explore our offerings and sign up for our e-newsletter. Thank you.
Thank you so much, Ping. Wonderful presentation, overview of your inspiring work. I am excited. There's so much to talk about. So I'm gonna not waste any time. We'll get right into it. First, I want to dive into, you did have some wonderful personal stories, as you just mentioned, Ping. Want to ground the conversation in the human impact that I was mentioning earlier, just by sharing, personal story myself. I've been passionate about arts and healing for a while, but it really grounded in my life personally when my son, Aiden, when he was 6 years old, got diagnosed with cancer. And thank God he's okay. But also, thankfully, he was at a hospital that did have a healing arts program. And so in the midst of, he went through 63 treatments of chemo and radiation. And in some of the worst of that, there was a wonderful Celtic harpist that came through and just helped him to ease his anxiety and to enable his mind and his body to rest, so that he could actually have the healing that he desperately needed in that moment. So it's helpful practically in that sense. And then beyond that, in the mental health way, I helped teach him how to play guitar that year. And he created songs. He wrote his first song, which was about going through treatment, and crafted meaning from the experience that helped him have a direction and a purpose for what he was going through and strength to get through it. So it's been personally very meaningful. And then, of course, with PTSD, with all of us afterward, there's been some wonderful effects of arts in that healing process. So, I guess one thing I will ask is that if any of you can go over kind of some of the main categories of people who really benefit from the arts, just to get an overview of, there's veterans with PTSD, there are people who survive domestic violence. Would you just all open it up to share kind of some powerful ways that we might not expect that arts is used in healing?
Well, I'll just jump in and say, when I first put a toe in the water in this field, I asked somebody in the field, who are the main constituents of this field? And I was told mental health professionals. That was back in 2004, I think. And now it's everybody. It's educators, it's community arts professionals, it's people in spiritual care. It's just it no longer belongs to anybody's domain. I would love to hear from my other panelists too.
Yeah, I would echo that. My first response as well, Trevor, to your question is, everyone, the arts can be beneficial to anyone and everyone. And I always bear in mind, as enthusiastic as I am, personally and professionally about these connections, the arts are also not for everyone. It's not a magic cure. But for many people and throughout history, we've seen these deep connections. The arts have always been connected to healing practices and traditions around the globe and throughout our history. So we know there are deep connections between the arts and health. So I think of the arts as an available resource for anyone. You don't have to be good at them. That's so true for me. Like, I will never be on stage. You do not want to, no one will ever pay to hear me sing. But I love it. It's so good for me, So you don't have to be good at it to garner the benefits of creative engagement. And I think one thing I will note that's very much happening in this field and in this discipline today is that we are gaining understanding through research and through practice of the more specific ways in which the arts can be applied to specific instances. We've had many examples of them today, but we see programs like dance for people with MS. There's unique ways in which dance can be really useful to people with MS and with Parkinson's disease, for example. So we're learning more about really specific applications, the use of wind instruments for COPD and asthma and, conditions of the lungs, which again, there's actually Army reconditioning manuals from World War I that specify some things like that. So this is not necessarily new discoveries, but there are a lot of new discoveries, and we can build on those understandings and build programs that can be lower risk than a lot of interventions, and not to replace medical care interventions, but to work alongside and to complement and to be a really essential component of more holistic care that our health systems can provide.
Yeah,
Thank
I'll
you,
just
Jill.
add to that I'm sorry.
Just
I was
prompting you.
I was just going to add that I agree with everything that they have said, and I think to the point that arts can be for everyone, and also they are not for everyone. I think what's been helpful in the classes or trainings that I provide is in my experience talking with people about trauma histories, talking with people about stigma, talking with people who have been incarcerated in those kinds of situations. We talk a lot about how in general society, especially in professional settings or public settings, I call them the 3 robot settings. Like, you are allowed to be slightly frustrated or upset, or like neutral, or like slightly happy. And anything that you are outside of those things is looked at as like weird, or maybe even a threat, certainly like pathologized a lot of times. And people start to sense that, like, if I'm having any kind of experience that I can't stuff into those robot settings, something is wrong with me. It's I am bad, or I am broken, or oh no, that I can't stuff myself into these robot settings. And I think one of the reasons that art is so helpful to people is that it's a reminder that that those settings are arbitrary and constructed and kind of stupid, if I can say so. Like, the human experience was never meant to be represented by those 3 limited ways that we in like Western white dominant culture in the US have said, like, here's how you can show up in public spaces and not scare us. So so in the arts, like, it's obvious that people are really sad. It can be obvious that people can be very ecstatic. It can be obvious that people can feel very broken and alone. And you encounter the arts, and that's why I said, like, you feel accompanied by the arts. You feel like your experience can be articulated, and you can stop maybe pretending for a second that the human experience has ever been anything but incredibly wide-ranging and vast. And that's the option to have a human experience that was tiny and always happy was never on the table for any of us. And I think the arts gives us maybe a felt sense of permission that, like, oh, whatever I'm experiencing has existed before. Like James Baldwin said, you think you're alone in the history of the world, and then you read, right? Like, it helps us feel less alone, and then also reminds us that what we're experiencing is part of what it means to be human.
Beautifully said. Absolutely. And that gets at some of the one of the next questions actually I was going to look at with you is, there are certain assumptions within healthcare, and one of the things that I think that unfortunately in mainstream mental health especially, there is this focus on pathologizing and on really looking at the disorder versus the wellness spaces you were speaking about earlier. And, one of the things I've been working on is a mental health docuseries called Meaning and Madness with Straight Up Impact and with Sir Ken Robinson and Viktor Frankl's grandson, Alex Vesely, in it. And the reason I mention that is Viktor Frankl, author of Man's Search for Meaning, really came from a meaning-based vision of healing, and that we are more than our suffering, and that we have a reserve within us that can heal us. So, I think that one of the things I want to ask you all about is incentives within the healthcare system. Dr. Clayton Chow, who's a renowned psychologist in LA County, oversees 8 hospitals. He spoke about how, with this DSM-based paradigm, really looking at pathology and disorder, that if the psychiatrist does not actually put in a code for a pathology, for a disorder, that they can't continue to see the patient and can't be reimbursed for their work. And so I think these kind of things are crucial, because you say, think about how that shapes our entire system, the way we approach wellness, and whether wellness is even a part of the conversation to begin with, So I wonder, what have you seen where in structural or incentive challenges can be addressed, and how can we integrate better incentives into this system? I'll start with you, Tasha, just because you were just mentioning it. Do you have any ideas on how we might be able to shift things? I mean, coming from an arts-based, resource-based perspective?
I mean, from my public health training and health equity, we need universal healthcare and universal basic income, hands down, right now, yesterday. Both of those things, that you should have access to your health, and you should be able to, see a doctor. That doctor should get paid for their work with you, or the nurse practitioner, whomever it is, regardless of an insurance company's willingness to reimburse them, or however it's set up to be. But then obviously, in addition to that, I think that you're right, there needs to be a system in place where, like, the people that we might go to for our care aren't required to pathologize our experience in order to be able to support us. And that does require rethinking how we set up models of care in our culture versus others. I know that Jill has spoken about that and talked about the way that other countries value the arts and value other parts of their well-being and their humanness differently than we do here.
Yeah,
Absolutely.
I think
Oh, Jill, I was actually going to pass it to you with a question on integrating into academia as well, and the role that academia has in kind of shifting those incentives.
Yeah, I'll address that, Trevor, and I just want to respond to Tasha, because I think it's there's a few things that are really important here. One is access to the arts. When I think about social determinants of health, I think about access to arts and culture. I mean, we know arts and cultural engagement improves our health and is good for our health. And we also know there's huge social gradients around who's accessing, in particular, more formal, organized arts activities that cost, and things should cost because artists should be paid, right? So it's there's a whole tricky paradigm to think about there. But there's a huge social gradient in who has access to those more formal arts activities. It doesn't apply as much to more home-based or group-based things like, singing in choirs, and, it doesn't apply as much there. But we really need to think about who has access to the arts. I also think there's a slippery slope that needs a lot of careful, slow exploration as we think about moving forward with the kind of systems that you're asking about, Trevor. There are billing codes, for instance, for services that address social determinants of health. There's third-party reimbursement for creative arts therapies, and that system works well. There's not enough of it in all the states, but that's a system that works well. And there's, as we think about how the service of artists could or should be billable in hospitals, for instance, or at community health centers, the kind of co-location of services that Tasha touched on earlier, could be good, but could also be really problematic if not designed really well, and could increase disparities and access, and could decrease who can, as artists, make themselves available, to people who are seeking the health benefits of the arts. So we're at a super interesting place in terms of, policy and dialogue in this country. Lots to explore, lots of opportunities, but I think things need to go slow and careful so that we don't, make mistakes there. Another thing that I feel strongly about, and this will be my segue to education, Trevor, is that as we've touched upon, I think artists who want to contribute to better health for individuals and communities need to have access to training. Tasha talked about trauma-informed care, and it's really important if you're inviting people who are dealing with particular challenges to come engage with you, you have to know how to receive them safely, right? So the way you invite, the way you put yourself out is really, really important. So I think that kind of training is super important, but I have hesitancy as well around over certifying, right? Or creating credentialing and certification that over legislates the spaces in which artists work, because artists work in very beautiful, important, organic, intuitive, wise, impactful ways with deep, valid knowledge driving their work. And it doesn't necessarily need to be legislated by professionals or systems from other disciplines or paradigms like health or healthcare. I think partnership is super important. Co-creation is super important. Partnered opportunity is super important. But we don't want to over legislate. And we're really careful about that in our educational programs. People who come to us in our graduate programs, for instance, are people who know they want to work directly in partnership with public health professionals or in healthcare systems, or, build the kinds of programs. And so they're looking for education so that they can really be grounded in that work and, and investigate their outcomes and things like that. So I think there's a lot of spaces in which people can place themselves, and the importance of education, training, credentialing, those sorts of things is going to be different in every space. But there is not and should not be a sort of let's do this to everybody and everything, as we're in this moment of opportunity and excitement. Sorry, that was a lot of words.
I'd love to add that the really positive thing that happened with the creation of the National Center for Complementary and Integrative Health. That didn't exist until the government woke up and realized that people were spending as much out of pocket for their own complementary care than as much as they were spending for conventional care. And so the good news is that the tail can wag the dog. I do believe that if people start using the tools, and if they work, the diffusion of innovations theory suggests that adoption of new behaviors actually can come about even more quickly by information passed from near peers, even more so than research. And I do want to say that research is important. The more we can provide evidence, whether it's verbal evidence, anecdotal, or whether it's research evidence, that this stuff works to address things that conventional care cannot do very well. I think that's where a strategy lies, is take those issues that for which people are currently throwing up their hands, whether it's dealing with people in incarcerated situations, whether it's dealing with violence, intolerance, all these things. Things are getting worse and not better. So if we can actually find ways to address those effectively through the arts, then we have a foot in the door, and then I think we're home free. I think this in the future the arts will be the next major healing practice to be adopted by the public, owing to its remarkable ability to address things that other modalities cannot, or cannot very effectively.
Well said, absolutely. And Ping, I want to thank you, first of all, for you introduced me originally to the whole social prescription movement. And it's just been really opened my eyes to all the incredible things that are going on around the world to integrate this. And, I want to talk a bit about kind of the partnership aspect and how we can kind of, in addition to creating programs that are educating directly, how can we integrate into civic life, and how can we integrate into academia? How can we partner with legislators, with educators, with board members, all the different ways that we can find pathways into institutions that already exist and kind of infuse them with the power of the arts for healing. So I'm gonna pass that to you, Ping, actually right after just suggesting something that Jill mentioned in terms of certification. I want to give a shout out that I'm actually helping to lead a movement right now to get California state licensure for art therapy. And we're actually hosting a conversation on this next Thursday with Californians for the Arts, Julie Baker, and leaders from American Art Therapy Association. So I know they'll drop a link in the chat about that. So I hope everyone can attend, and that'll be a great dialogue. But I want to say that is what's important about that is we're definitely conscious of making sure that anything like that would not be exclusionary and would not, lock out anyone who is using the arts for healing in any kind of way. It would just be a particular way of promoting the title art therapist that would then enable equity and access by ensuring that people can bill insurance companies that they will reimburse for the work, and it's happening in 11 states already. So we can definitely make it happen here, and that can increase equity and access to the 13 million people who are on Medi-Cal and Medicaid here. And it can also help to diversify the field because it can make it a more sustainable career to those art therapists. So, and hopefully that can then expand to the other creative art therapies and be an inspiration and kind of lead the way for that. So I hope that everyone can, join in for that conversation. But beyond that quick plug for that movement, I do want to, pass it back to the question before getting into the Q&A of Ping. How else can we create these partnerships? How else can we integrate with academia and governance to make these realized?
Yeah, I find the key is really, and this is a community health sciences strategy in public health, is really I speak to people from the point of view of their needs. So when I'm speaking to educators, I'm talking to them about things they care about, whether it's bullying and meanness or, trauma, resilience, finding the words that speak to them and offering up a partnership to address the things they care about. That's one thing. Reducing barriers to entry. I want to support what Jill said earlier, that I think it's fantastic that we're getting this credentialing because we need it on all fronts. We need people to be able to get reimbursed care. At the same time, we still have an access problem. There will still be people who can't access it. And so we also need initiatives on other fronts that are like what we're doing at UCLA Arts and Healing, providing education to anyone in the public who wants it so that they can start applying the principles in their own settings. And we use creative arts therapists as our instructors to create the curriculum materials. So this is kind of a way of taking those experts, taking what other people can use of their tools and having them be the teachers of others. So that's one way that we're approaching it.
Absolutely. Well, I have so many more questions that I want to dive into. I do want to give time for our audience to be able to dive in as well. I will say, as we dive into questions from the audience, I want to think about ways that we all can think about messaging and advocacy strategies. How can we collectively, as we are an advocate audience here, how can we share the story of this amazing research and these amazing results in a way that helps to move legislators and academics and so forth. So I'll leave that as kind of a frame for us to all have on our mind while I open up to a few questions from the audience. Do we have anyone with burning questions? We have some time here. Okay, as I wait for some questions from the audience to pull in, and maybe Kara, you can send through some directly. Oh, I got one here from Andrew. Just curious what results Dr. Senke's statistical research has revealed. Okay.
So I will be happy to put links to a few of our publications in the chat. We're just, we have to work with the National Endowment of the Arts to get everything up onto our website. And we're just in the process of getting our publications on our website. So you'll be able to find them and see them being added there in the next couple of weeks. But in the meantime, I'll pop some in the chat.
Great, thank you. I have another one from Kara. How do you all define the label creative facilitation?
Facilitation. Well, we use the term facilitators because we're not creating people to do something to someone else or make something happen. We're creating a space for a process to happen collectively. So it's a collective. The way that we work is collective, and that actually speaks to 80% of the world that is a collectivist in nature. Our country and Europe are kind of like the two individualistic zones, and so that's one approach.
Great, thank you. I have another one here. I'm curious if those who participate in the Social Emotional Arts Certificate program at UCLA Arts and Healing find that they're able to work through their own trauma as well while learning to how to facilitate trauma therapy.
Yes.
Which speaks to, I know,
Yes.
Tasha's point. Yes.
Absolutely. There's no distinction in this work between self-care and other care. Every activity that we engage in actually is dually beneficial. And we find that a lot of people are coming to us for personal reasons, or they came to us for professional reasons and ended up discovering the personal benefits. It's very, very common for people to say that. And I also did want to add that experiential education is probably the most powerful way to convince anybody of the power of the arts. And most people who don't have familiarity with the arts, you can tell them about it and they won't get it. However, if you can give them a couple of minutes of an experience, then they'll start to understand. And the virtual world has provided us with a new platform for delivery on a broader scale.
Yeah, I'll jump off of that to say that in the work that a lot of times when I'm talking about how the arts can affect public health, I work with organizations to notice, like, how can you be having multiple impacts? Like, there's a ebook about this on my website, but like, how can you have multiple impacts versus just at one level? So instead of just thinking about individual level health benefits, could you be doing other things at other levels, like culture, community, education, et cetera? So back to your point as well, Trevor, about how do we advocate, a big part of that and providing that experiential element that Ping was mentioning. A lot of times we invite politicians, local leaders, community organizers to our events or to help kind of like launch the book launch for a new publication of girls' poems, like that are poems by girls that are incarcerated, right? But the people that you invite to that event to give a talk, that's what they do all the time. They show up at places and give a talk, like, introduce a thing or something like that. But that also requires that they be there and that they hear what was happening. They hear from the people who have been part of it, or like they might create something while they're there as well. And it's so important to provide that experiential aspect. And there's lots of interesting ways that you can get decision makers into settings in order to be able to illustrate what's happening in the program.
Absolutely, that's a great point. It's always that personal storytelling, isn't it? The way that we connect to issues. So, while you're on this, I wanted to mention some of the work you're doing, Tasha. I know you briefly talked about the Culture RX program, but again, in terms of integrating the arts into civic life, it is amazing the way that you have this EBT Card to Culture, the WIC Card to Culture, and the Connector Care Card to Culture programs, which provide access to arts and culture through free and reduced admission. So it's such a wonderful way to lead into social prescription. And I wonder if that you have any thoughts on how to effectively use that model that you're creating and other social prescription programs at home and abroad to bring those to California, and how we can kind of get people hip to these wonderful ideas.
Well, I mean, I will say, like, that once you hear about like the EBT card to culture, you can't unhear it. Like, that makes so much sense. Why is everybody not just doing that, that you can use that card to get in anywhere that you're going? Like, I hope that anybody on this call, like, once you've heard that that exists in Massachusetts, you're like, hold on, why, what are we doing? Like, that's just so smart. So
Yeah,
I think
like,
that a big part of the persuasion of that might just be the idea. Like, before I had heard about it, it never occurred to me. And then when I heard about it, I was like, what is wrong with me? This is so obvious, right? So I think that part of that's going to be just sharing the information. And then I hope that sharing how this has gone in Massachusetts will be helpful to people. Like, the stakes are lower sometimes than people might imagine as far as piloting something and giving it a try. There is a big threshold for evidence if you were asking a physician to, for example, replace their treatment as usual with like a trip to the museum. Like, hey, instead of recommending that your patient go to CBT, how about you just send them to the museum? Like, for a physician to be willing to do that, there's a really high threshold of evidence that would have to be met as far as the benefits of that museum. But what we're hearing from the providers in Massachusetts is they are just so glad to have something that they can offer to their patients that isn't telling them what to fix, telling them what to do, telling them they need to eat more fiber or walk more steps or something like that. It's just like, I am giving to this opportunity to you, and it's just something nice. It is just something good. And they talk about, like, one provider said, in the field of medicine, we don't get many opportunities to like prescribe to make people happy. That's the way they phrased it. Somebody said, like, it feels like prescribing beauty in your life. They are anxious for these opportunities. They see that people need a source of well-being, to my point earlier, like a way to connect with other people. Sometimes they've talked about, like, oh, I see a mom who just hasn't been able to connect with her child. They're not conversing. Maybe if they go to the museum and spend all day there and talk about the art, they'll finally have a conversation without a screen. Like, they're using it in pretty interesting ways that doesn't require them. They're adding it to their toolbox. It's not replacing something else quite yet. I think, to Jill's point earlier, there are things that we know that art can do that could be just as good as treatment as usual, if not better. But at this point, physicians and nurse practitioners and other prescribers and providers don't have options to infuse people's lives with something that's just about their well-being, and they're looking for it. And that's why I said the stakes can be kind of low as far as implementing it, because the providers actually do want it, as long as there's a system in place that allows them to do it easily within their limited time with each patient. They want to be able to do it. They're not demanding more evidence. Nobody that I've met is skeptical about whether this is useful to their patients at all. Nobody. And yeah, they just need a system by which to do it. And then the risks of arts engagement are so low or minimal or rare that, again, compared to testing out or piloting something else, that this becomes a relatively safe sell, as long as the hardest part is developing the system by which people will do it. And in Massachusetts, it's been a little ad hoc. Like, each cultural organization had to reach out to a healthcare provider, and they kind of made their own partnerships each by each. And I think you could readily see those kinds of partnerships emerge and test themselves out individually, or of course you could do it community-wide or statewide.
Absolutely, and I'm glad to hear that they don't require a high threshold, but the great news as well is that if they did, there is research to show that it works. So as Jill has placed in our chat, if you're curious to look deeper into it. I wanted to share one more question here that we got in as regards kind of starting early with youth. As we all know, especially through the pandemic, it's been extremely tough on everyone, and especially the kids on Zoom school and everything else that they've had to deal with, the fears and uncertainty. So as we're addressing youth mental health and physical health, are there educational nationwide initiatives in K through 5 to teach youth about the power of the healing arts? For instance, kids teaching kids programs.
I will mention that the Department of Education has been funding arts integration programs, which allow for the inclusion of social emotional learning. And there have been a number of centers in the United States where that is happening. they embrace it actively. I actually participated in writing one of those grants. And so I think the point about young people is absolutely crucial, and that the arts could do a lot to perpetuate the appreciation and advocacy for the arts by providing young people with socially, emotionally supportive arts experiences that go the extra mile, that help them feel good about themselves and feel comfortable owning their birthright to participate in it. Because other people, when I speak to general public audiences, I hear so many people have judged themselves for their ability to do this, and they don't participate anymore. So then they don't become advocates, and then the people who get elected to public office don't value it, and then it's kind of a downward spiral or an upward swim. So I think that really planting the seeds with young people is important, because they're going to be the next stakeholders for the arts. And one example I have is medical students. I have the opportunity to work with a number of them every year, and they love this opportunity. And by giving them a few tools they might be able to use someday with their patients, we're planting seeds at a stage when they're incentivized. So the first couple of years of medical school, they can't see patients. However, when they have our tools and they can go in the hospital as volunteers, they can go in with their white coats and their badges and do this work and have an early experience with patients, to be able to experience the human side of being a patient, because they're addressing those human needs, and it's really transformative for them. And it's also wonderful. And the nurses, so we had them going in to work with the brain tumor patients, and then the nurses on that floor said, "Oh, could you also see the stroke patients and the traumatic brain injury patients?" That they appreciate the availability of this for their patients as well.
And I would add, Trevor, some of our research that I put in the chat, and Daisy's in the UK, has shown really significant associations between arts participation among youth and fewer issues with maladjustment, externalizing behaviors, behaviors that we term as reportedly antisocial or illegalized in the United States. And we know that those sorts of behaviors and the labeling that happens with kids, who do get, engaged in the legal system, have huge implications for health, across the lifespan. And so I think this is an arts education policy question, and it really harkens to the idea that's been popular for a while in public health, this notion of health in all policies, the idea that we can't address health just through health policy. We have to think about policy across sectors and across the spectrum. And I think, we could talk about arts in all policies in the same way, but looking more broadly at policy, and arts and education, I think, is a huge health policy issue.
Absolutely. And I think that one of the tools as advocates to mention is to just highlight the communication of social emotional learning and social prescription and various frames for the social determinants of health. I think as advocates, we really want to be conscious of these terms which have bubbled up, that have really helped to push people who might not be involved in the arts or might not be kind of advocates themselves for the arts already. But if we connect it to their own goals within each field, whether it's mental health or workforce development, whatever it is, using terms that have shown to move them to action, that these are important. So social emotional learning has been wonderful in education. And I think we can continue to kind of uplift these terms and these understandings. I'm conscious of having only a couple more minutes here, which is a shame because there's so much more to go, but there always will be. So I want to give everyone just a chance for just a real quick word of last things that you'd want to leave people with, any kind of campaigns or efforts that you'd want to have them keep an eye on or take action about. Any last words from our panelists? Ping, do you want to start?
I would say everyone brings their gifts to the table. So something that I've noticed is some people are anxious. Gosh, you know, if they learn mental health tools, they wonder if they're qualified, but people in mental health wonder if they can do the arts. Everybody brings their gifts to the table, and it all works. That's all I want to say. So I encourage you to dig in and explore.
Wonderful. Jill.
Yeah, I would say partner, partner, partner. I mean, this is a moment for cross sector. This is a moment for, you know, holistic, out of the box thinking, you know, as we, you know, come through this pandemic and move into whatever, you know, new normals are. This is just a moment for us to be thinking across disciplines and finding new partners and reaching in new directions. So partner, partner, partner.
Absolutely. Tasha?
I don't know how helpful this is, but in my work, I often think of myself not as an advocate for the arts, but as an advocate for the ceasing of the arbitrary exclusion of the arts. And sometimes that can feel semantic, but it makes a big difference in a lot of the partners that I work with. The fact that we've relegated art to specific spaces, or we think of it as something other than just the human life and the human experience, is not a scientific perception of what it is. Art is not other or special or deific or supernatural or especially interesting. It's part of being a human, and we leave it out to our peril in some ways because we're excising an important part of how we evolved to show up as human beings.
Could not agree more. Well, thank you so much. I know we're at time. I'm going to hand it over to Kara in a moment here, just to close out, but I want to thank everyone for being a part of this. The fact that we show up to these spaces to really deepen our understandings and bring more complex, kind of nuanced advocacy to the table, that's what moves this forward. You know, the more we are have a better, deeper understanding of not just how to communicate these things, but what is happening and all the exciting models that are working out there, and the ways that we can push this forward, the better we'll be at helping our communities to heal and helping our children, our families, our world to be more healthy and holistically kind of thriving place. So I want to give one last shout out to please do tune into the conversation we'll be having with Julie Baker from Californians for the Arts and American Art Therapy Association. The link I think had a little error at the begin with, but the same link does work now. It is public, so please do RSVP for that. We'd love to have you be a part of that conversation, and stay engaged. Please follow all of these wonderful panelists through their organizations on social media. Stay engaged, share, and spread the word. Thank you so much for having me be a part of this. Carol, I'll hand it to you.
Thank you so much. Thank you, Ping, Tasha, Jill, and Trevor, for what an inspiring conversation today. I know I feel really motivated and excited about the potential, the intersection of arts and health. And so with that, I'll just thank everyone again for joining us here today. A reminder, we will send out, I know lots of amazing things were shared here today. We will send those out in the follow-up email. So just know that we will send that along with the recording. And with that, happy Arts, Culture, and Creativity Month. And we hope you all have a wonderful Friday.
Thank you, Kara. Thanks, everyone. Take care.